It's so interesting to hear you describe this because building something significant, it's constant change. Teams evolve, your plans evolve, your opportunities evolve. So it's exciting to hear your vision and your path forward and everything going on. And you're always so wonderful as part of the startup health community because you bring what we like to say batteries included energy to the whole ecosystem. What's it been like for you being part of these Health Moonshot communities and interacting with other founders and other teams within the various moonshots and within Startup Health?
Oh, it's been amazing. Literally, I wouldn't have changed it for the world. And what I love, and Steve asked me actually on the SWAT meeting the other week, he says, what's the one thing? And I was like, patience. You guys have the patience of a saint because I am the worst. I am like, I'm quite an organized, structured person, but there's so much that you're just all over the place all of the time. And you can just dip in and out to the community and you can ask a question and you can get feedback and you could support somebody else, for example. But like you guys are there and you understand this in a way that I never can. I never will. If I do this till I'm 100, I'll never have the kind of understanding and the breadth of understanding that you guys have. We'll always get better at what I do, but there are like 50 other things that you guys are expert in that you bring to the table.
Well, it's what I love is we're one degree of separation. You have your expertise, others have their
Mm,
own, and you combine everybody together, and there's this extraordinary network of the
yeah.
best in their arena. And when you bring everybody together and they collaborate,
And you want them to succeed. When everyone goes, oh, 99% of startups fail, but you just so desperately want the community to succeed. Because whenever I've been on any of these calls, these guys are amazing. They have got
yes.
brilliant like products and ideas. And the other thing that is, I know it's awful, but sometimes it's quite reassuring to see that they're struggling too. Do you know what I mean? It's not, you're not
Well,
just that
you
big person
realize you're
who's
not
getting it.
alone. You're not alone. And it's such a struggle. It's a journey. It's a lonely journey. We have families.
Yeah.
We're balancing our lives, all these things, and it's never easy. So it does feel good to know, hey, I'm not the only one experiencing these challenges. This is very normal. This is part of the
Yeah.
process. This is part of the journey. And hey,
Yeah.
let's help each other through it
Yeah.
over
Yeah.
time.
But being able to help somebody. So I don't think I could help anybody from a business perspective. And I wouldn't expect anybody to expect help from me because, like, genuinely. But as a psychologist and a scientist and publishing a lot and all of that fun stuff. So there was a guy before the ADA with abstract for whatever conference it was. And he clearly had stuff that he could present. And I said to him, well, you should put in an abstract to the ADA or whatever it was. Submit an abstract because you have data and then you can present that publication. You're in publishing diabetes care, you can present that as building your evidence base. And he just had not thought of it at all and didn't think he had anything. And I'm like, mate, let me take a look at that because I think you've got something there. And he did. And
Yeah.
he pulled it together and he submitted it. And that being able to help in that way is nice as a community because
Yeah.
I'm never going to be able to help somebody from being a
No,
business.
you're selling yourself short. You help so the entire community. It's supercharged by everyone that's a part of it. So thank you for everything you're doing.